My name is Wendy Mis. I am a student at IUN. I'm working on my master's degree in public management. I'm nearing a finish. I'll be done in May of 2021. I'm very much looking forward to that.
I can imagine.
I am here today with Town of Munster Fire Chief, Chief Pelc, and Chief Pelc will more formally introduce him, but the project we're working on today is Partners in Conversation, and it's Grads Talk for Change. And the topic that I selected for this project, we're in the middle of this COVID environment, and I thought it was early on in the epidemic, national health emergency. Chief Pelc had some really good ideas, and I thought when this topic came up to do a project, he was one of the people that I thought would be an excellent speaker. He's fun, he's informative, he's throughout the region, has good information. And so I'm talking today about protecting the public health during a national pandemic. I am the Town of Munster Clerk-Treasurer. I've known Chief Pelc for several years, as before I was the Clerk-Treasurer. I worked here for the Town of Munster, and I was also the Executive Director of the Munster Chamber of Commerce. So I've been involved with Munster for many, many years. So Chief Pelc and I are sitting here together. We have already started the conversation, and then we had to hit record. So I'd like Chief Pelc to introduce himself a little bit, tell us about his background. He has grown up here in the Town of Munster Fire Department, and sadly he's nearing retirement. I don't know how we will ever replace him, but I'll let Chief Pelc tell a little bit about his background.
Okay, I was born and raised in Munster. I actually just moved out here within the last several months. I lived here for 68 years, went to school here. Had always wanted to be on the fire department. As a small child, I used to hear the sirens, and I always wondered where they're going. As I grew up, I was able to get on the bike and ride. I was close to the town hall where the fire station was, and I used to try to follow the fire trucks to where they were going. So in my background, I guess in my heart, I always enjoyed the fire department. So as I went to school, I graduated, went to St. Joe College in Rensselaer. And after about a year and a half, 2 years, I realized that college was fun, but it wasn't always for me. So I felt, what could I do otherwise? Well, I left school, then I applied to become a firefighter in Hammond, but at that time they wanted you to have residency. So I thought, well, I'm not ready to move to Hammond just yet. Well, then all of a sudden I heard you can get on the Munster Volunteer Fire Department. So that was back in I believe it's 71 that I joined, and then I was called to service. I had to go I went into the National Guard for 6 years, but during that time, I was still on the fire department. So I slowly moved up through the ranks to a battalion chief. And then I believe it was 6 years ago, unfortunately, through the death of Chief Knizek, I was able to step into his shoes. At that time, Battalion Deputy Chief Bill O'Brien asked at his time that it was time for me to step in. And so I took over, and then a year later, the Town of Munster decided to go to a career position again, which at that previous to that, Jim Knizek was the town coordinator, emergency manager for public works and fire. And so then they made me just asked if I become chief. So here it is today. So as Wendy said, I am retiring next January 31st of 2021. So it'll be about 49 and 7 months. 49 years, 7
so
months.
Close to the 50.
So close, but truthfully, as 1971 hit, I never looked for years. It's just been a great journey, and it's going to be, I will miss it. I think I will hear the sirens, and I will keep in touch so I can know where everybody's going. And it's been a great ride.
Well, I know we love having you here, so it'll be sad. You're replaceable. So.
Yeah, I know I've grown to know a lot of people. A lot of people have left, and a lot of new people, and are very nice people. I always enjoy talking with people. I talk too much. That's part of my life.
That's why I knew this would be an easy interview. We're going to hit the hot spots.
I'll tell you anything you need to know. I don't mind. I'm very open, so very grateful for it.
Well, we're great. Again, I appreciate your time today. What we're looking at is how public safety and economics and COVID kind of all come together. So we're looking at the coronavirus, which became a national health emergency in March. And public safety had to prepare for it. There was a national lockdown. Now we're slowly reopening and recovering, and just where do we go from there? So we're going to hit a couple of those topics along the way. Um, First and foremost, this struck me. We were at a department head meeting, Chief and I, as well as the other department heads, in January or February, and we were just starting to talk about the COVID-19 and how it's going to impact us. And Chief, do you remember one of the things you said, how we can stop this virus in its tracks?
We had just gotten back from a large gathering of District 1 out in Valpo University, and one of the medical directors from Indiana stated, and I agreed at that time, probably not a bad idea, but if we would shut down everything for 2 weeks, we could kill this in the bud, nip it in the bud, because at that time, I believe there was only 16 to 20 people had passed almost worldwide at that time, or in the United States. I can vaguely remember that, and that struck me as that, okay, we could probably do this. It's very, very challenging to do that, but given a little time, we can tell everybody in 2 weeks, we will shut down everything and we can get through this. But we all have a forward belief that it's not that bad. Everybody's going to take a different way, the panic and everything, but that might have been able to way when the doctors first thought that, but we've never been in that situation to just close everything down. It's very difficult. We're a very open society, so that was challenging, but that was one of the directions. I made that statement not believing it myself, but here we are today.
And when you said it, I laughed. I'm like, oh no, we could never do that, ever. And from an economic standpoint, how would we have ever survived shutting things down? Everyone gets 2 weeks vacation in their home and that's it. Yeah. And then we waited a little too long. We ended up shutting everything down.
Anyway.
Yep. And the
it was
impact.
A lot harder.
Yes. Yeah. Yep. So what did you guys do at that so you talked about shutting everything down. We know that at that time was not possible.
The first thing that came to mind when we got back with the other departments that were there, we discussed what would we do with our PPE. It was known that we were going to have to probably wear masks. It was going to be a contagious type of disease. So preparing for that, all departments, both here in Illinois that I know of, and in Indiana, have a surplus already in stock, but the amount that we may have to use in the time frame was challenging. And then as it started to progress, it was realized that, wow, more of the EMS side was going to be need of equipment. And so the state started turning to, or the departments started turning to the state, we need backup. There's always been a certain emergency allowance, but in different categories. This was a category they weren't really sure of, so the surplus wasn't as available as we thought. So we ourselves in Munster were very fortunate that we had stocked up, as where I believe the police department did, with just the mask and some light gowning. And so we were pretty fortunate.
Okay.
We've had a stock that is maintained, and other departments haven't been as fortunate as we have, so they have been taxed quite heavily to find more. Today you can drop it, you can go anywhere and pick up what you need for the most part.
That's what I thought. It seems like the only thing we can't find right now are wipes, like Clorox wipes, but things, all the face coverings and shields and all of that, and the state provided, even the town hall, as a business, the government, we were able to access their warehouse. So did you have any issues with having to transfer some things over to the hospital? We have 2 major hospitals here in Munster.
They were very fortunate getting the supplies they needed. We offered if need be, but for the most part, they were pretty well set, and they were able to contact their agencies, the state EMA and everything helped out quite a bit. The federal government did supply. It took them longer, and it was where it was needed the most. And I think the way we're set up, the states are pretty well governed to manage their own needs. So Munster itself was, we were self-sustaining
Okay.
as far as our departments, but with double hospitals, they were a little more challenging. I even know to this day that the University of Chicago is still strapped for different departments. The ER is covered,
Okay.
but
Oh.
my daughter works in neonatal. They're using plastic bags still
Really?
for coverage for the gown side. And it's just a more economical disposal, and it's safe,
Yeah.
but it's just kind of warmers, at least with a cloth, you can at least breathe in them, but
Poor
they
thing.
haven't, the masks are good, everything, it's just that the gowning, they're using plastic bags because there's still a search for more. And I think it's economics, that how far does everybody want to spend
Mhm.
finances?
Yeah.
Plastic bags are cheap.
Yeah.
Compared to a gown. You know.
Which they're marketing as
Yes.
medical grade.
Oh.
So- So we locked everything down in March. The government said, we recommend everyone except essential workers stay home. So we're government employees. I came to work every day. You came to work every day. What kind of calls did you see during that time?
It had really lessened down to the point, the only thing we were fearful was that is once you lock down, people are home all the time. And sadly to say that accidents, fires, emergencies seem to happen when more people are at home.
Mhm.
Just as this year's fire prevention is kitchen fires, because a lot of people have still been home, so you got to be more cautious. It put a concern from our department, myself here, was that volunteers, are they going to come out?
Okay.
It is dangerous.
Manpower.
The manpower side, the critical departments for the career departments became the same way because of overtime. If somebody got sick, the quarantining was mandated quite heavily in the beginning. So that put a burden on a lot of departments financially, because if you had one person got sick during the shift, the people along with them had to take off for so many days. So now you have to pick other people in overtime. So that became a very high priority. And so in Mavis 207, excuse me, and Illinois, we're tied in with Mavis 24, we had a group agreement that we will help other agencies if they are critically hit by the COVID. And
Nice.
fortunately, that never had to come about.
That's great.
But that was had on early on in March, April, that would be done,
Okay.
because we knew that COVID could easily take down the station. And now we also, at that time, we started disinfecting. And we felt if the station got one person had COVID, we need to fog and disinfect the entire place. So that became a burden for economics. So it's just a trickle down. It was challenging. But the biggest fear we had, from what your question was, the type of calls actually slowed down. People were pretty cautious here in Munster
Mhm.
and surroundings.
Okay.
The EMS side was still strong, but for the most part, the other activity, accidents, there was nobody driving.
Yeah.
That cut back tremendously. I bet we were 30% less
Wow.
car accidents that we've been called for. And I monitor all the departments, and that was probably the same with them.
Excellent.
But it slowly, around April, May, started to pick up, and then June, July. Now we're back to normal.
Okay. That's what I thought.
Pretty
We were
much,
kind of.
yeah.
So during this time, you guys are a little cut off. I wanted to mention, just because I think it was a wonderful thing that you did. We had Easter during the lockdown, and we had the 4th of July during the lockdown. So kind of two opposite things. During Easter, you were really generous to the community. And what did you guys do?
Well, we decided, it was brought up by the group, my chiefs, that to decide that maybe we can take the Easter Bunny and drive him down every street in Munster. So we calculated it would take probably 9 hours to do. It was end up 12. But I'll tell you what, it really was gratifying to drive down the street and see people coming out in their front lawn and waving with the kids. And we thought about giving out candy, but at that time it was just too soon.
Mm-hmm.
But just seeing the smile and the look on the kids' faces was really, really good. And we kind of partnered with the police department at Jim Rice, decided to do birthdays, young kids' birthdays.
Oh, I
And-
forgot about that.
and,
That
yeah,
was
and
nice.
I tell you, that came into, and it was amazing what that did too, because I think we've all today even are all frustrated to this day, but back then it was even harder. It's the kids, I think, suffered, you know, they're resilient, they can get their games, they can, today with the computer, you can do all sorts of activity, but it's still, you want to see your friends, you want to get outside. It was a beautiful, beautiful summer,
Yep.
very warm, and kids are stuck in the house. So that Easter, I think that helped get us over the hump a little bit. It really did. And it ended up taking us 12 hours, but it was worth it.
It was worth it. And my kids were 22 and 25 at the time. And we heard you a block over and we went outside because it was Easter. We couldn't spend it with our
Right,
families.
right.
It was still fairly new in the whole thing. It was
Mhm.
such a great community event. And then a little bit on the opposite side is the 4th of July. Every 4th of July, this was a hard decision for the town to make, but we
Mhm.
canceled our 4th of July fireworks. And I think the nice thing about that for the fire department and our police as well, public works, is they never get to spend that time with their families.
Right.
They're
It was
out
the
doing
first time in
parades.
many years.
So it was, it gave us the opportunity to spend the day with our families, which
Oh,
we
okay.
normally don't. And so it
Right.
was, you know,
It was a trade-off. My wife loves fireworks, so not to have fireworks was very, you know, as the show, but I tell you, people did spend very, very much of their money buying fireworks. The home fireworks shows were excellent.
they were.
And we were all very, very concerned, seriously, that we were gonna have some issues with that, but all county-wide, even, you know, I'll use Illinois again, since we're tied in with Illinois, there was hardly an incident anywhere. People were very, very conscious safely, and that's what it takes.
That was good.
So it gave something that says, well, in the future, we can shoot them off everywhere, okay, as long as we don't get, careless. We're okay.
Exactly. But I think everyone was on high alert.
Oh, yeah, yeah.
So after the 4th of July, things started to reopen. And you said traffic accidents
Oh my
are
gosh.
coming back up again and calls are going back up again. What else is going on right now during this reopening as businesses are opening back up?
It's back to normal. It's just still, the biggest issue is that the COVID still exists. We all know that. And EMS is still strained.
Okay.
There is a lot still. The PPE is still being used up quite a bit. The county, the way we get our emergency calls, they're notified whether we use universal precaution. That's where we got to gown up totally.
Okay.
And we support, in Munster have our own private service that we contracted with Superior.
Okay.
So we back them up. So we have to be also using this, what they need to help, we have to be cautious. So I think that is a expense that is still out there. And it's a, you tend to want to get lax, as you know, everywhere you go, you got to wear a mask now.
Mhm.
And if I feel like when I wear it, I feel like I'm robbing somebody because it's like you just old movies, the cowboys and Indians when I was growing, little kid, that's how old I am. If that's what was on TV, that you saw that, it was everybody's mask man. And so today you're wearing the mask and it's a good thing, but it's a challenge. And then with the cell phones, people are talking all the time, the web pages, people are on the phone, that once we start driving again, this is where we have accidents. And I think that has been a big burden on all departments, that EMS side, with the fire side,
Okay.
that the traffic is back to normal. So that means we're having a lot of accidents again. So
Okay.
that created the turmoil, and it still is today because of like I say, the PPE is still, a lot of people trying to save money. There's a lot of gouging on the purchase. You can buy it almost everywhere, but different agencies charge you a little bit more, and everybody's trying to keep frugal and not overburden the taxpayer, because we are spending taxpayers' dollars.
Yep, we got to be careful about
Gotta
that.
be careful.
Because
best we
your
can.
clerk-treasurer watches every
Oh,
bill.
yeah. I go, oh my gosh, we gotta buy some more or something, but no.
No,
the
it's
government has helped us out a lot. We've all been stipend,
Yeah.
I guess you could call it that, or gifted a COVID
the CARES
amount-
Act has been
yes.
incredibly helpful to recoup some of those unbudgeted costs that
Mhm.
we've had to assume to help keep the entity safe. And so we're very fortunate. There's a
Right.
lot of things, and there's been some improvements we've been able to make in the building, even this, all the shield, all the glass, the
Mhm.
partitions that we put up and stuff. That's all good.
Yeah.
One of the things that you do is you educate the public, and every year you have a big open house, and the kids love it, the adults love
Yeah.
it. It's get a lot of donations, and it's an October event. It would be this
This week.
upcoming weekend.
This week,
This
right,
is
yeah,
Fire Safety
yeah.
Week, and sadly, I hear you had to cancel that.
Yeah, it was not taken well. They call me the king sometime down at the fire station. You make the choices, but I really felt more and more. I talked with our group, and we felt it because if one child or one person had found out they had COVID after the event, and we had 500 people down at the fire station inside, which this time was still reluctant to have a lot of outside people come through the station because of that, that we just decided that it's not a good practice to have everyone come through. We did not go through the schools. We're trying to give some web-based programs that the teachers can have. We're handing out items that we're sending to the schools to be handed out that is packaged and sealed so that it's all been sanitized, if you will. It's not been touched by public hands. So we're giving that to the schools. But yeah, as a whole, we're not asking for any donations this year, which normally we try to fund the programs. We felt that businesses haven't been doing 100%. Why tax them when we don't have to? The home stores, yes, and the grocery stores, excellent. They have not hurt, but we look forward to a lot of the restaurant and small business people to support, and I just didn't think it was right.
No, it's not a good time to ask for a donation right now.
And
So
having the kids ride the fire truck, there's been other departments. I talked with the chief the other day from Homewood, and some people have asked, schools asked us, can we bring the kids down to the station and look at the fire apparatus? And they said, you're welcome to do it. We'll have the vehicle outside, but you're gonna have to stay 6 foot apart, have masks, and then when you go into the vehicle, we have to sanitize it. So they said they prefer not to, and that's what we were at. We didn't want to have to sanitize, wipe everything down after every time some kids went through it. We had one family, the next family, that the burden and the time frame and the spacing just wasn't going to work.
Didn't work.
It's really, everybody looks forward to this.
They do.
And I look forward to it. I've been doing it for many years now, and it's a fun event. I see the smile on everybody's face. And the kids, we got the balloons, we got the jumpy house we bring in, and the fire trucks. Yeah, they like to watch. We burn down a few homes. You know, we got a practice fires in the back, and kids love it.
They love that.
I love it. I watch how our guys perform. I say, well, they need work.
No, they don't.
I'm always critical of myself, but no, they do a good job. But my grandkids love it.
Yeah.
They always ask me, you know, and I'm very fortunate that I let my grandkids ride in my car in the parade, and this year I got the 5 of them live up that come up here for this, and they asked me, could we be in the car this year since it's your last year, and I wasn't able to do that. So it hits you, you know, and they'll live through it because it's only a day, and then it's okay. But it makes me think, that would have been nice. And so the 4th of July, and now it's difficult.
It's been a change, most definitely.
It's a sad note. Now we're going to partner up with the Crime Night Out that's happening Tuesday, but unfortunately we have had a firefighter that was killed recently last week.
South Holland.
And the walkthrough at the funeral home is Tuesday night, so we're not going to be able to participate in that because we thought, along with the Crime Night Out, being it's Fire Prevention Week, we can kind of go with the parades, but we won't be able to be participating this year.
Sorry about that too.
Yeah,
that was a young man too, very young, tragic. I'm going to segue now to the future. So what are we going to do now with COVID-19? I think you've had some meetings.
The big thing, we partner up with Mavis 24. It's a pod, and the state of Indiana has it too, but the meetings that we've had is if we do get a vaccine that comes forward, how are we going to distribute it to all the people in the county? And this has been a challenge because sadly, I think a lot of people are going to want to get it right away, and coming in at one time is a challenge. And they're looking for ideas. We really haven't pinned down how it might come about, but with the county health department, they'll work with the fire departments because we're the largest entity that they can work with. We have the most EMTs, paramedics. We'll work with the ambulance services along with that, but we're going to be partnering with them. So because the medical staff in the county, both Lake County, Cook County, Illinois, is a challenge.
Okay, so it's the medical expertise that you guys bring.
Yeah.
And you guys did that in the flood of Munster was one of the areas that was hit hard by the flooding in 2008, and you did that with the vaccines then, or the tetanus shots, wasn't it?
We gave the tetanus shot. Then they had the N1H1.
Oh, yes, yeah, I forgot about that.
Was through the county.
Okay.
And it worked out real well. And that was fortunate. It was only the young and I believe pregnant women were the biggest key factor at that time that they wanted to be tested. Wasn't everybody had to be. So that disease was, they only partnered to take care of what was needed. Here's everybody. So how this will come about, we'll see. They're waiting, we're getting a lot of tests out there to how, and if it's going to be done with a needle, that puts a little different twist on it. The N1H1 was to spray in the nostrils, so that was easy to administer. It could be done by EMTs, but to have inoculation with a needle factor becomes either paramedic. So the medical field has more, get nurses, but I believe the medical field will step up. Right, we'll just have where's the biggest issue. Where to put it on and where they can do it in a place that is more public, so we could sanitize it and things like that. And I think we will work together on that. Yeah.
And that's still a little ways away.
I think so.
All right, I think that pretty much covers everything. Our local safety officials, you've always been working on keeping us healthy, especially during this. Yep, and you've worked with other communities. I like that. I think that's what's unique about being a firefighter is that you guys really are a band of brothers. That young man that passed away, you mentioned it first thing the day after it happened when we had a department head meeting, and you could feel the sense of loss that you had. I don't know if you knew the young man or not, but it's still, you feel it.
I've had acquaintance with him, but I think as a brotherhood, sadly here, over my 49 years, I've had to witness young people that have tragically died, and even sadly, fellow retired people and fire chiefs here in Munster. I've buried too many friends, and it's like everybody. We all have acquaintances and friendship, and when somebody passes, you miss them, and it hurts you. But I think the fire service, it's just, I look at it a different perception, and it's to know that it just hurts because as fire chiefs, we've always grouped together. We have meetings once a month or 2 times a month, and both in Indiana and Illinois. So you get to know a lot of people. And I'm not saying police don't do that, but fire is a little known to be a little bit more coordinated on it. It's just a concept we have because the demand for a lot of help is necessary. It's got to be very, very coordinated. And we've been getting a lot of practice, and that's not good, but we've looked for the future. The flood was a good example. The aid that we got, it really helped Munster out that time.
I just think that anytime there's a big fire call, there was one over at Hampton Highland not that long ago, and how all the departments come together. You have to know each other. You have to work together in order to battle something that size, the flood, those type of
and
things.
All firemen are crazy. We're going in when you're coming out. So it's just, but it's all like doctors, nurses, any profession. It's a job, but certain things people enjoy when you're doing it, or you wouldn't be doing it. We all like to be home. We all not like to be at work, but there's times that you don't mind working. I think personally, I think most everybody enjoys some part of their job, or they wouldn't do it. or should go someplace, find
That
something.
they should
to
find
do,
something,
because it
exactly.
makes
Life is short,
a lot
yes,
easier.
exactly. And then we know what we've learned from this COVID is that we do need to work together. We do need to listen to the experts and those type
Definitely,
of
and I
things.
think we have. Yeah, it's a challenge right now. The masking is very challenging. It's cumbersome to me. You feel like I put it on, I feel like I can't see because I got it up over
It goes
right here, right by your eyebrow. And I said, you just feel like, can I just take this thing off? And then you got to look at everybody's eyes. You can tell if they're smiling or if they're ugly, but you do look at someone's eyes, you get to read a lot.
Yes.
And I think people are all looking at each other going, wow, but we have to do it.
We have to do it.
Hopefully in the coming months, we can eliminate it.
That would
And
be
I don't know
great.
if the vaccine is going to be the answer or what.
Or just everybody's keeping their distance. And
That helps.
the good thing is the cases are up, but hospitalizations are down.
Very much.
So it's,
yeah.
I don't know if it's the strain is getting less
It
intense.
may be
or
mutating and it's less intense and it's just becoming, well, I'd have to look
I don't
back
know.
100 years ago, see what they did.
Yeah.
We knew they had a spike months later, but we're here today, so it did work.
It did work.
They didn't wear masks for 100 years, so we're okay.
so hopefully
History repeats
soon.
itself. It'll be soon. Yeah, we just gotta look at those dates. We gotta be getting.
We got to be getting close.
Yeah.
All right. I think unless you have something else,
No, Wendy,
Chief,
thank
I
you.
really appreciate your time and your expertise and helping us out with this project. So I thank you
I like
so very
people.
much.